The patient lets you know 8 hours in advance that they are going into cardiac arrest. You, as a healthcare professional, how do you know that your patient is within an 8-hour window of having a cardiac arrest? Knowing how to resuscitate is one thing, but preventing cardiac arrest is much better because you don't know and you have no guarantee that a person who goes into CPR will come out of it alive. So the best thing to do is to prevent a cardiac arrest. So what's the purpose of this video here? To show you the signs that a patient presents 8 hours before having a cardiac arrest. Now, speaking of 8 hours, how much time do you think this patient has before they might have a cardiac arrest? What hour is this patient in? Are there 7 hours left before they arrest? 6 hours? Is there half an hour left? 10 minutes left? Follow the video so you can better understand all these points. Don't forget to like, share, and subscribe. If you become a member, there are several specific brand new and exclusive contents every week for members. Consider it. Shall we go? The month of May is the most important month for nursing worldwide. It's when we celebrate our profession, our achievements, our determination. Taking advantage of this month of May, we also have Mother's Month. And look how wonderful that is. Si credi credito. Sicobi Credicom has a special credit offer starting at 1.87%. Look, it's really worth doing a simulation. I'll share the link below and the QR code here for you to use this offer in May only. When we say that it's only for the month of only, algo pesado. But when we say that the patient gives warnings, isn't that interesting? Wait a minute, but if the patient is showing signs they're about to arrest, why do I let them stop? Wouldn't it be easier for me to make an effort to study so they don't go into cardiac arrest? Right? Stop and think. Isn't it better for me to study? Isn't it better for me to study to prevent cardiac arrest? Isn't that much better? Think about it. So let's go, guys. What is cardiac arrest? Cardiorespiratory arrest. It's when we have a change, okay? Throughout the entire human body. So what keeps the body alive? So we know that the body is made up of cells that make up the organs that make up the human body. Let's just focus on the cellular unit. A cell, why does it survive? It is a eukaryotic cell, right? It needs oxygen, okay? It has aerobic respiration, not anaerobic. So this cellular unit, it needs oxygen, it needs glucose. Glucose enters the cell and is broken down into pyruvate. Pyruvate enters the mitochondria. Mitochondria, Krebs cycle. After the Krebs cycle happens, we move on to the last phase, which is phosphorylation. Oxidative, which requires oxygen, right? So when oxygen enters the cell, it generates many moles of ATP, which is adenosine triphosphate, and that's what produces cellular energy, right? So let's continue. Every patient who has respiratory failure, whether it's because oxygen isn't coming in or because CO2 isn't going out, that patient is at serious risk of going into cardiac arrest. Let's analyze why. If oxygen isn't entering the vascular system of this patient, the cells throughout the patient's entire body, lacking oxygen, will also lack cellular energy. With a lack of cellular energy, what can this deficiency lead to at the cellular level? Anaerobic respiration, releasing lactate due to oxygen-poor respiration, which will be insufficient for cellular functioning. If a cell is having difficulty, the group of cells is having difficulty, that organ is having difficulty, and then which organ is it? Several. So imagine a group of organs deprived of oxygen. The outcome is clear. This person is going to have a cardiac arrest. Another thing, if I'm having trouble removing this CO2, if we increase the CO2 retained in the human body, the automatic result is a reduction in the pH level. When we have a reduction in pH level, we then have acidemia. Acidemia makes it so that the cells can't work or function in a very acidic environment. So, to be more exact, for those of you who maybe haven't studied biochemistry very deeply, let's think about it this way. A pH below 7 is almost incompatible with cellular function, with human life, right? So, A patient whose pH is getting close to 7 because they're having too much CO2 is someone who's going to crash and probably won't come back if the cause isn't corrected for this patient. So in other words, just with oxygen and CO2, I can pretty much explain everything. So let's go. A person with a hemorrhage, lost blood, is losing oxygen. So they're going to lose cellular energy. A person who had a traumatic brain injury, a severe traumatic brain injury, so they're losing cellular energy. Someone with a severe traumatic brain injury lost his respiratory drive after hitting his head. Without breathing, he loses oxygen. Another patient with diabetes suffered damage. Respiratory drive, if he doesn't breathe, he loses oxygen, right? A patient who has diabetes, how did you think about it? The guy went into metabolic acidosis, hyperosmolar, ketotic anyway. In other words, I have acidemia as a factor which can trigger the patient's death. Car accident where the guy hits his chest there and he can have a collection of blood inside the pericardium where the heart is. This guy can have tamponade. A car accident can also cause chest trauma, which can lead to pneumothorax. If the lungs develop atelectasis, right, if they decrease in size and the alveoli collapse, we don't have the pressure difference, oxygen doesn't go in, CO2 doesn't go out. The protocol is clear for a cardiorespiratory arrest. I could mention a million possibilities here. What do you need to understand? Oxygen constantly needs to be coming in and CO2 constantly going out so that a person doesn't go into cardiorespiratory arrest. Any person, any human being who arrives at emergency care and is having difficulty getting oxygen in and CO2 out, that person has less than 8 hours to survive. The more critical the patient looks to you, the closer they are to cardiac arrest. A patient who looks like this, look. The guy who is already tachypneic, that guy is much closer. Why? Tachypnea is a compensatory mechanism for a problem that has already happened. They are trying to compensate to avoid a cardiac arrest. The more critical you find the patient, the closer they are to arrest. The faster you can intervene in this situation, the more likely you are to prevent an arrest. Whether you will succeed or not will depend a lot on your level of knowledge, the teams, the place you are, and the equipment you have to care for this patient to really save this life. Is it easy? It's not. And there are toxicological factors, right? There are medications, medication overdoses, and other situations that in the end will lead to the same thing. There will be difficulty getting oxygen in and carbon dioxide out, or something like that. So basically, that's what we need to take into consideration. 8 hours before, the patient will not show tachypnea, tachycardia, hypotension, altered level of consciousness, or necessarily an increase or decrease in temperature. This can be secondary to another problem the patient has, for example, septic shock. But with septic shock, what do I look at more? Hypotension. Hypotension is what I'm paying the most attention to there, from sepsis that progresses to septic shock. So the patient will show signs. And if you're a good professional, a sign isn't just information to write down in the medical record. A sign can be something worth investigating so we can take action before something bad happens. Did you like it? Do you want more clinical examples for you to apply in your daily work? Leave it here in the comments. I want to see if this video will be good or if you prefer videos about people's deaths or controversial topics. Let's see. If this video does well, it's because you like this kind of content. If this video doesn't do well, it's because you like bad stuff and politics. I'm going to find out from this video, huh?